Om Shri Gurubhyo Namaha. Om Shri Dhanvantare Namaha. My humble pranams to all my Guru and Lord Dhanvantare. At the outset, I would like to thank NEMA office bearers for having me here and all the staff and faculties of this college. So you had two very good brainstorming sessions on different aspects of the topic, and now it is my turn. I will take you to the journey of Uttarbasti. My journey of Uttarbasti started from my PG days. Being a Panchakarma specialist, I started practicing Uttarbasti. Maybe more than 20 years I am doing Uttarbasti. And yeah, so I know Basti is told as Ardha Chikitsa and given so much importance, but Uttarbasti being a very small part of Basti, but still not so much highlighted as Niruha and Anuvasana Basti. So let us see about Uttarbasti. So when you say about Uttarbasti, there are two things. One is Yonigata, another one is Garbhashayagata, and this presentation is purely a practical presentation, nothing much about theory, totally how I practice Uttarbasti. Right. So we know that Uttarbasti, as the name indicates, there is a word called Uttara. Uttara means answer. Answer. Uttara is also means the next. The next. There is some nakshatra called Uttara, Uttarashada, Uttarabhadra, Uttara. Actually in Jyotisha Shastra, Uttarashada, Uttarabhadra, Uttara are the best nakshatra. Rohini, Uttara, Trayam, Nakshatra, Shreshta. So that is why something Shreshta, something very special is Uttarbasti. Now there is the word Uttara also means the Shreshta, the next, the answer, etc. There are different meanings to Uttara. So Uttara margena diyamanataya kimva Shreshta gunataya Uttarbasti. Actually, even the definition of Uttarbasti was not given by the Grahatrayis. They neglected Uttarbasti so much, but it was the commentator Agnivesha who says, the commentator Chakrapani who says this definition. So the Marga, Uttara Marga refers to the Marga above the Buddha Marga. So that is the vaginal route in females. And it is given to some Shreshta Vayava. We know that uterus, without uterus, pregnancy cannot happen. But there are few incidences outside uterus also, but still, uterus is a must for pregnancy. And in texts, Acharyas say that administration of drug, which is the Uttarbasti, not into the Garbhashaya, but they say Garbhashaya Yoni Mukham Prati. It is not intrauterine, but say that it is intravaginal drug administration is Uttarbasti. Now we have two based on the drug application. One is Yonigata, where we administer drug into the vagina, and you have the Bhashayagata Uttarbasti, where you administer drug into the uterus. And Like you have two, Niruha and Anvasana, or Kashaya Basti and Sneha Basti in as the classification of Basti. Even in Uttarbasti we have two, Nairuhika Uttarbasti and Snaihika Uttarbasti. In the Snaihika Uttarbasti we use Tailas or Kritas or Yamaka also, but in Kashaya Uttarbasti we use Kashaya, not Vakshikam, Lavanam, Sneham, all those things are not used. Kashaya is used. Now, these are the anatomical structures where our drug is going to act. So, we know that all these things. Now, what are the indications? If you see the indications told here, there are conditions, all the Yoni Rogas have been mentioned. All the Shukra Dushti and Artava Dushti. So hormonal, even the other structural defects, see, especially Apara, Dustiti and Garbhashayagata Vyadi. Even uniconvate, biconvate uterus are also coming under this. But even though there are some doctors who claim that in these congenital anomalies also Uttarbasti may be applied, but I have personally have not done. And Aparadustiti, low-lying placenta can also be, Uttarbasti can also be done there. And the contraindications are, the only contraindication according to Ayurveda is Prameha, maybe because all the other Bastigata Vyadhis, Uttarbasti, that is urinary Uttarbasti is indicated. Prameha is a Sarva Dehika Vyadhi, that is why Uttarbasti may not help. And other things are hypersensitivity, cancer, fistula, vesicovaginal fistula or urethrovaginal fistula, rectovaginal fistula, all these things it is better to avoid. And congenital and genetic deformities. Now directly coming to the vaginal Uttarbasti, we know that Drishta Karmata Nissamshaya Karavana and Asamarthata Bhayakarana. So I will, with this presentation, I will remove all these things, Bhaya from you, and you should all practice Uttarbasti. Very simple procedure, but yet very, very effective. So beautiful and elegant. Now, so some of the conditions of vagina, cervix, uterus and ovary, you can practice vaginal Uttarbasti. Problems with secretions, either high, low, all those things, inflammations of vagina, infections of vagina, cervix and any other problems in vagina which is causing infertility. Even in cervix, all these conditions, secretions, inflammation, erosion, anti-sperm antibody, even endometrial reasons which cause infertility, in all these conditions you can practice Uttarbasti. Like Basti, you know, Vamana and Virechana, there are one drugs only which cause Vamana and cause Virechana. But in Basti, any disease you can give Basti with different medications. Similar is the Uttarbasti. So these are the contraindications. Now these are some of the textual references which says about the Uttarbasti Netra, and here one thing you have to see is 4 angula you need to insert. The Acharya says you need to insert 4 angula which comes around 6 centimeters, 7 centimeters, and that is the length of our vagina only, not into the cervix. Basti Putaka, these are the classical references. Now, for vaginal Uttarbasti, what are the Basti Netra? Red rubber catheter is okay. Or you can use these instruments like bladder wash, that can also be used, and the Putaka can be a syringe. So this is usually an Anuvasana syringe whose total quantity is 50 ml and 100 ml. Both are available. So you can use this instrument also. Now, dose, very important. Vaginal Uttarbasti. So how much you can put into vagina? If you see the references from the class 6, it varies from 1 pala to 2 prasada. That is almost 50 ml to 200 ml. 50 ml to 200 ml of dravya can be pushed into the vagina. So now it is up to you to take any range from 50 to 200 ml. I would say 50 to 100 ml will be okay, because if you put more, the medicine will not retain in the vagina. So 50 ml, 50-60 ml if you put, it can be retained. That is how Uttarbasti is different from Yoni Purana or Yoni Pichu. So you retain a large quantity of Aushadhi in the vagina. So you can take 50 ml, 60 ml, up to 100, not more than that. It may be varied with Vaya and Avastha, or it can be fixed. Every day same dose can be fixed, or you increase the dose day by day. So that can also be done. Now the Kala. So in Atika Avastha, in emergency, Uttarbasti can be given in any time. But if you want certain effect, then you have to see the Artava Kala, Artava Dwadasha Vishe. So initial, it is the time when the os is open and the cervix is soft and the Avarana Rahita, that is what Acharya says. So this way is seen, or the os is open and the cervix is soft. This is the time soon after the menstrual cycle. Soon after the cycle, the os is open and the cervix is soft. Then again it becomes hard, and later just pre-ovulatory phase. Again os is open and cervix is soft. So these are the 2 times when you can administer the Uttarbasti when you need an effect in the endometrial uterus, endometrial tubes or ovary. If you want the effect in the vagina or external cervix, you can do it at any time. So you have to select the time according to the condition. Now, how to schedule? There are different ways of scheduling the Uttarbasti. Acharyas say that Dvi-3 Asthapana Shuddhebhyo. So give 2 or 3 Niruha Bastis, then start the Uttarbasti. This is the how the Acharya says. And I also practice in the same way. So give 3 Niruha Bastis for 3 days. Day 1, 2, 3 Niruha Bastis. On the 4th day, 5th and 6th day, go for Uttarbasti. Now, if you want an effect on the ovary and ovulation, or if you want an effect inside the uterus, then your Uttarbasti days will be 11th, 12th and 13th. 11th day, 12th day and 13th day, pre-ovulatory. In such case, your Niruha Basti will be 8th, 9th and 10th day. 8th, 9th, 10th day Niruha Basti, 11th, 12th and 13th day Uttarbasti. So this is one way of administration. There are different other ways. Go for morning Yoga Basti. You go for Yoga Basti in the morning, and in the afternoon time you go for Uttarbasti for 8 days. This is another way of practice. You can select any schedule which is convenient for you and your patient. 3 Niruha Bastis in the morning and 3 Niruha Bastis in the afternoon. So within 3 days you will finish. finish. Next is 3 days of Niruhabasti followed by 3 days of Uttarbasti. This is the classical way. Classics how Acharya Vagbhata clearly says this. 3 days of Niruhabasti followed by 3 days of Uttarbasti. And if you can't give Niruhabasti, you can only practice Uttarbasti for 3 days, 3 sittings, 5 sittings or 7 days. Next, one more practice according to classic is 3 Niruhabasti followed by 3 days of Uttarbasti, then give a gap of 3 days, then again give 3 Uttarbasti. So this is also a classical reference. Commonly practiced Uttarbasti is for 3 consecutive days, months, 3 consecutive months, but need not be, because for some cases who like previously as both the doctors had told, they come after a very long gap of infertility, then 3 may not be enough, 4, 5 sittings may be necessary. Now, how to do the procedure? Purva karma 2 to 3 Niruhabastis. Pradhana karma is Yoni Prakshalana followed by Uttarbasti, and the Paschat karma is the rest and the Ahara. Now let us see how it is done. ये नहीं है, the other PPT. UB प्रतिज्ञा. So such a simple and important procedure. If you don't have enough sterilization options in your clinic, you can go for vaginal Uttarbasti. You just need to have some boiler, sterilizer, etc. But many times people hesitate or feel discomfort in practicing Uttarbasti. But Uttarbasti is such a simple procedure, you don't need much investment also. Very simple, very easy to practice. UB Pratigna, PPT. Yes. So the things which you need to practice Uttarbasti is so this is the medicine. This is the medicine which you need. So you can autoclave it, but if you are using Taila and you autoclave, the paka changes. So it is, when it is Taila, better not to. You can use the patra autoclave, but don't autoclave the aushadhi. And you need a whole towel, and you need gloves. See, Uttarbasti netras can be a IV cannula. Very simple. IV cannula can be used as a Uttarbasti netra. Infant feeding tube. You can cut the infant feeding tube, the 10 centimeter from the base, and that can be used as a Uttarbasti netra. And this is the Uttarbasti Putaka, the syringe. You need a cuscus speculum to open the vagina and to see the cervix. This is for cleaning, sponge holding forceps, or an artery forceps will also be good. Artery forceps if necessary. You have to clean from outside and also from inside. The perineum also should be clean, and even the vagina should also be clean, cervix. Now see the uterine sound. So if it is a pre-ovulatory period, with uterine sound only you can open the os. You just have to poke a little and the os will be opened because it is soft at that time. And few swabs and few cleaning materials, that's all. So these are the things which you need for doing Uttarbasti. Now, a vaginal Uttarbasti. This is vaginal Uttarbasti, not uterine. So here I have used xylocaine, but you can use the thyla which you are going to administer into the as a drug. The same thyla can be used. Now see, slowly administer the cuspa speculum, fix it, and see that cervix is exposed. Actually, you can see the cervix here. Now, if it is a vaginal Uttarbasti, how you can do? Initially, you have to do a yoni prakshalana. So now I am using for demonstration, only water is used, but otherwise you can use some kashaya, Triphala kashaya, Panchavalkala kashaya, Nimbadi kashaya. So any kashaya of your choice can be used for yoni prakshalana. So after yoni prakshalana, you clean the vagina and the cervix. You clean the vagina and the cervix. And see, this is 50 cc syringe, 50 cc. So since it is vagina, you can use this syringe and administer the aushadhi. Since vagina is highly, it has a rich supply, so it is better always go for a vagina Uttarbasti than using a intrauterine Uttarbasti. Same, simple, very effective. So always go for a vaginal Uttarbasti than going for a Garbhashayagata. If you do a Garbhashayagata, you have risk. Little bit, not much, but without risk you can go for vaginal Uttarbasti. Now, moving on to the uterine Uttarbasti. See, so administration, route of drug administration is Uttarbasti, and administering drug into the uterus is uterine Uttarbasti. So again you need instrument, dose, time and medicine. Now, these are the different bastinetras which can be used for uterine administration. IV cannula can be used, IUI cannula can be used, or SGSG cannula can be used, and red rubber catheter, commonly used is red rubber catheter, or infant feeding tube. Infant feeding tube can be used not on the first day. It is difficult to administer it, push it inside, insert it through the cervix. On the second day you can use the infant feeding tube. Very cheap. So all these are very cheap actually. Doesn't need much investment. And this is the So here I have taken 10 ml 10 cc syringe. So you don't administer more than 10 cc in intrauterine because the total volume is around 6 ml. So you don't administer more than 10 ml. Now these are the instruments as we had seen. Custus speculum, Hegar's dilator. Usually I don't use, but there are practitioners who use Hegar's dilator to dilate the cervix. But if you use Hegar's dilator, you need to hold the anterior lip of cervix with vacillum. That again causes injury to the cervix. So it is better not to use dilators. Now you need a lithotomy table, you need a Kelly's pad, autoclave machine, cold towel, you need the medicine which you are going to administer, and these are cleansing agents. Again cleaning material. This is for prakshalana, yoni prakshalana. Okay, now coming to the dose of intrauterine drug administration, Uttarbasti. So Acharya says 1 to 2 prasrita. Again, 1 prasrita is 100 ml for Basti. But for Uttarbasti, Swanguli Moola Samhitam. Swanguli Moola Samhitam. Correctly, Sushruta says that it is Swanguli Moola Samhitam. As the name of the seminar is Saushruti, we should always follow Sushruta. So Swanguli Moola Samhitam, we took the measurement of 100 girls and it gave around 10 ml. So finally 10 ml was chosen as the dose of intrauterine. But there are doctors who practice only 2 ml administration, fine, no problem. That is a very safe way of uterine Uttarbasti. Even 5 ml also people administer, and even 10 ml also, not more than 10 ml. Okay, and very slowly if you administer 10 ml, actually this oil will go to the fundus and it will come back. Again slowly push, it will go to the fundus and it will come back. Excess amount of drug will come and stay in the upper part of the vagina. So there, in such case, there are 2 ways of absorption, endometrial absorption as well as vaginal absorption. Now again, Kala is Arthava Kala, we had discussed. Arthava Kala is a time when it is a time of Avarana Rahita Kala. It can be pre-ovulatory or post-menstrual, where os is open and cervix is soft. Now coming to the medicine. So we know that we have to, as a Purva Karma, we have to give Niruhabasti. Which are the Niruhabastis which can be administered? So if you want a Tridoshahara effect and a Niruhabasti which has the indication in infertility, that is Mustadi Yapanavasti. Mustadi Yapanavasti specially indicated in almost all types of infertility. The same can be used as the Purva Karma. Lekhanavasti Kapahara. So you want a weight reduction along with, or a Karshana effect along with this Uttarbasti, Lekhanavasti. Erandamolata Niruhavasti, Kafavatahara effect, Erandamolata. Ardhamatrika Basti, again Shukra Dushti is indicated, so you can go for it. Vaitarana Basti, very simple with little ingredients for Durbalas et Tikshna, small amount et Tikshna, Kafahara, you can go for Vaitarana Basti. Dashamula Nirubasti, still many other Nirubastis can be used for as a Purva Karma for Uttarabasti. Now, for Yoni Prakshalana drugs, Triphalakashaya, Triphalakashaya, Kafavatahara, even Pittahara also, Panchavalkalakashaya, Pittahara, so inflammatory conditions, Pani Yakshara, ulcers, inflammatory condition, Pani Yakshara, Nimba Kashaya. If you want a Nimba Kashaya is Rukshana. So if there is excessive secretions, ulcer, healing, all those conditions, Nimba Kashaya can be used for Yoni Prakshalana. Now, some of the medicines for vaginal Uttarbasti. So nowadays there are a lot of people who come to us with what do you call reduced lining, repeated abortions, repeated DNCs. Such patients, their AMH level is very low, lining is very thin. In such conditions, you can go for Phalasarpi, one best drug. Maybe vaginal or uterine, you can go for Phalasarpi. And I have practiced Phalasarpi with Mahanarayana Taila also. Phalasarpi with Mahanarayana, Yamaka, it becomes a Yamaka Sneha, but still gives a very good result. Even further, so you need not have to stick on the same drug for 3 months or consecutive next Uttarbastis. So first you can start with like Phalasarpi, then you can go for Yamaka. Later on, go for Dadimadi, which is actually Pumsavaneshucha. It is indicated in Pumsavana. Dadimadi, Sukumara. So such things you can go on using one by one as the next drug. So these are the common things which increase the lining and AMH level. Along with that, you need internal medicines also. But since I am concentrating on Uttarbasti, I will be telling only about Uttarbasti. Now, tubal block, another common conditions which come to us with tubal block. So, commonly, Hingu Triguna Taila or Uttarbasti Taila. So, this is commonly used, Hingu Triguna Taila. Since I use the medicines of Cortical, so we have these drugs, these medicines available. Hingu Triguna Taila, Uttarbasti Taila. Sometimes I add Kshara into this Taila only. Kalyanaka Kshara, Palasha Kshara can be added, a pinch of things can be added to this, and that can be used. And fibroid, not subserous, external like mural, submural, which is there in the musculature. There, Kshara Taila or Kasisadi Taila. Sometimes with Kshara Taila, cortical Kshara Taila is very mild. So sometimes you may have to add little Kshara into that, pinches of Kshara into that. Add it with bit of Tankana, Shatadauta with Tankana. Sometimes Murivenna, Jatyadi Grita, Jatyadi Taila is also used. One special thing happened, like if there is a cyst or a polyp, Uttarbasti Taila gave a very good result. The polyp actually detached and came out. Then in endometriosis, even if we cannot treat endometriosis, but the pain can be subsided with the help of Tiktakagrita, Mahatiktagrita, Sukumaragrita. So the pain can be subsided. Prolapse, first degree, second degree to some extent. Kshirabala Avarti or Dhanvantara Taila Avarti can be used. Sukumaragrita also gives good result. So in amenorrhea, when you want the ovulation to happen, Tila Taila, even the plain Murchika Tila Taila also gave result. Increase the lining, you need all Brahmana like Shatavari Grita, Vidaryadi Grita, Sukumara Grita, Phalasarpi, Mahanarayana Taila, etc. etc. Now we have few medicines which are here for vaginal Uttarbasti. For discharge, if too much secretions, then go for Triphala Kashaya. If it is dry vagina, then go for Shatavari Grita, Vidaryadi Grita, Sukumara Grita. If it is erosion, you can use Kshara application or like I have told Jatyadi, etc. Itching. Then Aragvada Kashaya. If you want healing, if there are ulcers and if you want healing, then Jatyadi Grita. Anti-sperm antibody. This is another condition. Along with the internal medicines, you need to go for Indukanta Grita, Uttarbasti. Burning, Mahatikta Grita. Bleeding, Durva, Swarasa, Lajjanu, Kalata. Now, some medicines for Garbhashayagata Uttarbasti, tubal block. So, tubal block can be of two types. One is because of adhesion, another may be because of inflammation, too much inflammation. If it is if you want a Pittahara effect, go for Kumari Taila, Kafahara effect, Yavakshara Taila, Saindhava with honey. So, another special combination. Mix Saindhava with honey like how you mix for preparation of a Uttarbasti, then administer. Sometimes what happens, it becomes too much thick, Saindhava and honey, you mix also, it is thick, then add little bit of Triphala Kashaya into that, make it into a proper consistency, then administer. But the problem with Saindhava and honey is, most of the patients will complain of pain. And in tubal block, when you administer Uttarbasti, some people say that, yeah, I feel like going, the Aushadhi is going this side, going that side, etc. So this is the speciality of Uttarbasti in tubal block. Tortuous tube, Nirgundi Taila, very good. Endometrial factors, Shatavari Grita, Vidaryadi Grita, Sukumara Grita, Phalasarpi, Oligomenorrhea, Kumari Taila, secondary amenorrhea, all these things. Now, some of the snehas which can be used in infertility are Phalagrita, Phalakalyanaka, Shatavari Grita, Shatapushpa Grita, Kshirabala Taila, Narayana Taila, Mahanarayana Taila, Tila Taila, Lashuna Taila, Prolapse, okay. And so if you want, if everything is fine and if you want to induce ovulation, you can go for directly Shatapushpa Taila, Shatambhadi Taila, Narayana Taila. Now coming to the Garbhashayagata Uttarbasti procedure. So you have to make the patient lie down like this, then visualize the cervix, insert the cuscus, visualize the cervix, then it looks something like this. Cervix looks something like this. Then slowly insert your Aushadhi through the cervix into the Garbhashaya. So the Aushadhi, the pictures are from somewhere else. The Aushadhi goes into the uterus. Now this is a video. Play the video. Yeah. So patient after the initial Purva Karmas like Nirugavasti or Yogavasti, whatever, Virechana. So the initial for infertility, we start with Vamana, Virechana, because Karmat Uttarbastiyantau Kuriyadata Vishuddhaye. So starting with Vamana, Virechana and followed by Basti, Yogavasti and Yoni Prakshalana. The patient is made to lie down on the lithotomy table and all the Aushadhis and necessary instruments are autoclaved and kept ready. See, we have a whole towel, cleaning materials, Aushadhi kept ready, other instruments, and I commonly use the IV cannula as the Basti Netra. So that is also there and patient is ready. So we need to this is a very old video when we do not have enough facility for taking videos. So first, after gloving, take the Aushadhi. So this is 10 ml Aushadhi. So the Aushadhi is kept ready, and the Basti Netra, we take out the needle from that and fit with the Basti Putaka. So the Basti Netra is ready now. Can you make it little bit faster? फास्ट कर सकते हो, थोड़ा आगे आगे नहीं. So if you use the IV cannula on the first day, second day if you want you can use infant feeding tube also, because that is very cheap compared to the other things. Even IUI cannula is also good for Uttarbasti administration. Finish after this video. So air is removed from the Basti Netra. So initial perineum is clean. The first thing which you do is cleaning the perineum. So if you don't take proper aseptic precautions, there are chances of getting infection. And with uterine Uttarbasti, some patients feel pain, spasmodic pain. So for that we usually give Dhanvantara Guliga or Hinguvacharya Guliga, or sometimes it persists for a long time, you can go for Matra Basti also, which will reduce the pain. Usually you don't go for painkillers. So with Ayurveda measures only we can manage many a times. After cleaning externally, we will put the whole towel. It's a bit lengthy video. वो आगे आगे कर सकते हैं फास्टर. Can I skip this? So we don't use the xylocane. Instead, the same oil which is used for administration is used for greasing. Now administer the cuscus speculum. So you can see the cervix. Actually this cervix is a bit eroded. So the patient already done yoni prakshalana. So you need to clean. The kashaya is still remaining there in the vagina. So we will clean the vagina 2-3 times properly. Cervix is visualized now properly, and you can also visualize the O's. Next is uterine sound. Just put the uterine sign to see whether the os is open or not. So if it is not open, you have to just poke a little bit so that, just poke a little bit, you can open the os. Now take the aushadhi. Now slowly push. Take your own time to push. To push 10 ml, take 5 minutes. Slowly push, because the quantity is 10 ml. If you push it fast, it may go through the tube and then from there to the peritoneum. So peritoneal spillage we don't want to happen, because that will produce some other complication. Now only the aushadhi is very slowly administered. So once you finish 2 ml or 3 ml, the aushadhi will start coming back through the outside, which will stay there in the vagina for a very long time. So both in the uterus and also in the vagina you have the aushadhi. Okay, so this is how it is done. Shall I close it now? Okay. So the whole 10 ml was not administered. See, Aushadhi is there in the vagina. Now slowly you remove the cuscus. So the common complications are these, and the action is, it is actually having an action on the Apanavata, both local and systemic effect. Thank you one and all for hearing me. Hope this will be of some use to you all, and after this presentation at least 10% of you will practice Uttarbasti. Thank you one and all. I thank Kamini ma'am and all the dignitaries present in here for giving me this opportunity. Thank you.